Welcome. Today we're discussing the top causes of treatment delays for Lyme disease that I've encountered in my practice. One of my patients was ill for 18 months. She had a tick bite and an atypical rash. Her ELISA titer was positive for Lyme disease, but she only had 2 IgG Western blot bands. Despite multiple evaluations, Lyme disease was considered but dismissed after a negative Western blot test. She presented with chronic neurologic Lyme and postural orthostatic tachycardic syndrome, also called POTS, and required extensive treatment due to these delays. Fortunately, she improved after treatment for Lyme disease, but the delay made her recovery more challenging. Here are the top causes of treatment delays I see in my practice. Absence of a tick bite. Many patients don't recall being bitten by a tick, leading to delays in considering Lyme disease. Absence of a rash. Not all Lyme disease patients developed a rash, which can cause misdiagnosis. Atypical rash. Only 1 in 4 Lyme disease cases present with the classic bullseye pattern. Equivocal or negative test for Lyme. Equivocal or negative test for Lyme disease. Equivocal or negative test for Lyme. Inconsistent or negative test results can lead to delays in diagnosis. Equivocal or negative tests for co-infections. Co-infections like Babesia may not be detected, complicating diagnosis. Dismissal as another illness. Symptoms may be mistaken for chronic fatigue, fibromyalgia, gastroparesis, or other conditions. Inadequate public health information. Lack of awareness and information can lead to delays in seeking appropriate care. Poor understanding of the signs and symptoms of Lyme disease. Misinterpretation of symptoms by both patients and healthcare providers. Stigma associated with the diagnosis of Lyme disease. Fear of stigma can prevent patients from seeking a diagnosis. Difficulties finding a doctor who will treat Lyme disease. Access to a doctor experienced in treating Lyme disease can delay treatment. Reliance on symptomatic treatment or alternative treatments, focusing on symptomatic relief without considering Lyme disease. And lastly, reluctance of professionals to consider Lyme disease. Some healthcare providers are hesitant to diagnose Lyme disease. Addressing these challenges requires raising awareness, improving diagnostic methods, and ensuring better access to doctors experienced in treating Lyme disease. Patients and healthcare providers need to be informed about the various presentations and complexities of Lyme disease. Understanding the causes of treatment delays helps us improve the timely diagnosis and treatment of Lyme disease. If you or someone you know is experiencing unexplained symptoms, consider consulting a doctor experienced in treating Lyme disease. Thank you for watching, and stay tuned for more insights on Lyme disease.